Morning. It is 10 o'clock in Minnesota, so we're going to go ahead and get started. Thank you for joining us. My name is Tim Broderick. I am the director of our technical team for poultry, and joining me is Aaliyah Gelati, who is our product specialist on the poultry side. Today, we're going to be reviewing how to conduct a necropsy and what it can tell you about your poultry operation. So to get started, why are we actually here? What's the value of necropsy or a field posting? Really, in our use, it's a great barometer for flock health and identification of different challenges, both within disease and production performance. We usually use it first as a baseline. We want to monitor flock health and understand what our birds looks like both inside and out. Knowing your normal, that way you can communicate with the broader technical team as to why. There's different degrees of necropsies that we're going to touch on a little bit later. But even on the producer level on farm, there's other valuable ways that we are able to utilize these techniques. These include taking samples for laboratory submission when we see specific challenges, helping to determine potential causes or reasons for mortality, as well as just get a broader sense of what underlying challenges exist in a flock, whether it's tied to a specific disease from bacteria or viruses, or metabolic conditions, or even environmental stresses. So we want to stress first that necropsies can look different depending on the setting. There's the clean, pristine environment of a veterinary diagnostic lab suite where we're looking a lot more at histopathology, taking different samples, doing microbiological analysis, all to complement the actual gross pathology and necropsy. And then we also have what we're going to be discussing a little bit more today, which is kind of that field posting. While not necessarily as clean and pristine, it still provides producers and technical staff with quick available information that relates to the general health and performance of a flock, as well as the basic frontline understanding of what potential diseases or challenges a flock is experiencing. Now, before we actually start opening up and posting birds, it's really important to first create a plan, understand why you're actually there in the first place, and look at all the paperwork and background information a flock provides. So we really recommend whenever I go on farm or Leah posts birds, one of the first things we're looking at is just checking production records and logs. How is this flock performing before we even look at a bird? We're looking at barn settings, controller settings, have they been medicating anything in the water? What's their normal health programs look like? What's their baseline production? So that we can understand if there's any areas that might be in need of additional focus. Say feed intake has drastically reduced or water intake has increased. Things that we can look at beyond just the bird, might be equipment, environment, etc. Based off of that, we want to identify the reason for that posting. Are we just posting birds to general checkup, make sure that the flock is in and maintaining health? Are we looking to benchmark some type of program, maybe look at vaccine parameters or any type of previous condition that arose in previous flocks, but maybe not this one? Are we seeing a performance concern? Are we seeing a dip in production or that flock looking in a way that is not performing up to its breed standard or historical production? Or do we suspect a disease challenge? Are we seeing a high mortality event? Are we seeing changes in fecal form and consistency? Something that's kind of raising those alarm bells. From there, we want to make sure that before we go on farm, all of our equipment is there and we're reviewing our protocols. When we go through and Aaliyah walks through more of the actual tools and techniques for posting birds, it's really important that you do it regularly and maintain protocols and procedures that you're comfortable with. Everybody kind of has their own procedures as well as different ways that they prefer to look at the birds. And it's important to just be comfortable so that you have a established baseline and understand that you can hit all those benchmarks that you need to. Also, we want to make sure before stepping in a barn that we're doing that hazard analysis, looking at biosecurity considerations, adhering to any farm protocols if it's not our own farm, and even if it is, making sure that we don't have a risk of transmitting something between barns or flocks. We understand the risk of communicable diseases, not just between poultry, but zoonotic conditions between poultry and people, and especially for things like suspected high path avian influenza cases, taking the appropriate actions, which may be to wait, call state veterinary services, etc. So what's the baseline starting pattern? Generally speaking, you can go pretty bare bones and be okay with scissors, gloves, some type of spray, cleaner and disinfectant such as Novosan for dipping birds, getting a clean work surface so that you can lay out both your tools and the bird, something that's easy to clean up, paper towels, trash bags, and again, bucket with water, disinfectant, and soap. So again, once we've reviewed those background protocols and procedures, we have all our equipment laid out, we've understood the records, we're actually now in the barn looking at birds. How do we actually select the animals? First is we want to make sure that we want to get kind of an appropriate sample, which is fairly small sample size in all things considered within poultry operations. And it does depend on whether or not you're looking for a specific disease challenge or just doing maintenance. This can be as little as one bird sampled for every 3,000 birds in the house. For basic baseline checks, you can go as little as just like 5 birds and still get a fairly representative selection. That said, especially when we see a challenge where we know we're there searching for some type of discrepancy in performance or health, we want to make sure that we get a representative selection. Those largely include any mortalities, preferably that morning or that day, but definitely within 24 hours. If on the longer side of 24, we want to have those carcasses refrigerated so that we can look at fresh mortalities without any extra decomposition. We also want to look at animals that are exhibiting the signs and symptoms that have us concerned. Are birds having hawk issues? We want to get some that are having those swollen or enlarged hawks. If it's some type of challenge relative to discharge that we're seeing in the eyes, we want to go and collect some birds that are exhibiting those symptoms. But it's also important to grab 1 or 2 birds that we feel are healthy. A lot of these conditions, we'll say E. coli as an example, can operate as secondary challenges. So it's important to kind of understand what the baseline health on the flock is. Are birds that appear healthy still exhibiting these same symptoms internally? And that helps gives us a range when we look at understanding the dynamics of any particular challenge.
Right. So, like Tim said, it's really important to make your observations in the barn first and make sure that you're getting some birds that, are showing symptoms of a challenge if you are experiencing a challenge, and also some healthy birds. So, making sure that you're making those observations in the barn before you pick out individual birds is really important. But so, once you actually do go to look at an individual bird, you want to look at, what does the bird look like overall? It sounds simple, but it can tell you some really important things. And it can also differ depending on whether or not you have picked a live bird or if it's, a mortality that you've picked up. Looking at some of your mortalities, there are, a lot of things are going to look different than a live bird, but there are some things that you may be able to notice depending on how fresh that mortality is. And so I'm going to go over some of these items here: your head, face, neck, chest, wings, legs, vent, and your feather cover, and give a pretty quick overview of, like Tim mentioned, what's normal. And I might address a couple of things you can be on the lookout for that may not be so normal. So starting off with the head and the face, looking at your eyes. I mean, these birds should have very bright eyes, no swelling, discharge, cloudiness, and they should just look alert generally. It's the face is a pretty major area where you can see some respiratory and potentially some viral challenges, as well as external parasites. Fleas, lice, sometimes mites like to get on the head and the face, especially because it is an area with high blood flow and less, obstruction. They can get to that skin pretty easily. So we can look for external parasites there as well. Also, listen to the bird. Is their breathing raspy, labored, wheezing, coughing, any kind of respiratory symptoms? You can probably sometimes hear before you can see. And then you can also go down onto the neck and feel that crop and tell whether that bird is on feed or not. And then looking here, we do have a better picture of an examination of the comb and the wattles, making sure that they're, firm, not shriveled or discolored, and they're not too pale. Moving on to the mouth, inside of your mouth should be free of any mucus, inflammation, or any kind of buildup or plaques. Mycotoxins, for example, can lead to some lesions that looks almost like necrosis in the mouth. And so if you're seeing any of those types of lesions, that's a sign that you may have mycotoxin contamination in your feed. Next, we're gonna, want to look at underneath the wings, especially considering that, it's a dark, warm place. A lot of external parasites really like this area. It provides them protection and they don't really like, exposure to bright environments. They like a warm and dark place, and this provides them with that. So parasites such as mites or lice can show themselves underneath the wings. And then you could also need to look and make sure feather cover is good underneath there. And the wingtip should be free of any kind of dried mucus, because that can also signal any kind of respiratory distress as a result of the bird kind of going to wipe their face, being uncomfortable. Maybe they have some mucus or discharge coming out of their nasal cavity or their eyes, and they're trying to wipe away that discharge. And so that may result in some dried mucus on the wingtips. Next, we're going to look at your legs. And again, this is something where you can, see, like Tim mentioned, in the barn environment, is their gait normal? Is it an injury versus a nutrition deficiency? Do they have any signs of external parasites here? Scaly leg bites are a big one, and you can see raised scales when you have scaly leg mites present. What is the color of the legs? Are they dry? Are they flaky? Or are they that bright, nice yellow color? Are they full? If the skin or those scales seem to kind of be vacuum sealed to the bone, that's a pretty good indicator of dehydration. And then again, with your mites, you can see your legs and feet may be a little paler than normal. Anemia can be caused by a severe mite infestation, so that could be a sign there as well. And then you can also just take a look at the bottom of the feet. And that's going to be able to show you a couple of things. Think, are there any lesions present, or is there any swelling on the bottom of the feet? Making sure that you have the proper environmental conditions for good foot pad health is really important, because at the end of the day, birds may not move around or be as active as if they're uncomfortable moving around. If they have, inflammation or lesions or something like a foot, it's tough for them to get around. It doesn't feel great. And so they may be less motivated then to go to the feeder or go to that nipple to drink if they do have something going on the bottom of their feet. Next, we want to look at the vent area, looking at, is it dirty? Is there any loose stool present? If it's real dirty and there's a lot of fecal material on the vent area, that could be an indicator of diarrhea. Are there any signs of pecking? Feather cover, is it good? Or is it clean? You want to see this clean vent area with a good solid feather cover at the end of the day. And you can also take a look closer. It's an area where you can also observe some external parasites such as mites or lice. And that's important, especially when you consider that the northern fowl mite, this is their preferred location on the bird. And you can also, when you're back here, check for signs of pecking or other lesions, prolapses, inflammation that may have been hidden if you do have a bird with good feather cover like this one. Just as a side note, I did want to include this. You can tell if the bird is laying by taking fingers and kind of palpating that area between the pubic bones. If you can get around 3 fingers between those, the bird is actively in lay. So I just wanted to note that as well. not necessarily looking at a disease challenge there, but it can indicate whether or not you're having a productive bird or a productive flock. Looking at feather cover next, I know I've briefly mentioned it, but looking at overall feather cover is important. Your feathers should be uniform, shouldn't look like they've been pecked or broken. And this is important because these provide a way for this bird to thermoregulate, and it also protects against things like injury or infection. Aggressive mating can also result in feather loss on the back of the bird. So, whenever you're, like Tim was mentioning, keeping track of what you're seeing, just write it down, making a few quick notes. Note where the feather loss is occurring, because a lot of the times when you have that aggressive mating behavior, it's going to result in feather loss or damage on the back of that bird.
Thanks, Aaliyah. And generally speaking, it should be noted that there's obviously going to be differences here between broiler, layer, turkey operations, as well as within sector differentiation. And what I mean by that is caged birds versus cage-free versus organic. We see differences in feather cover with more controlled environments. We also see differences in general feather wear in caged environments versus non, as well as kind of differences in picking and other behavior. So, with that in mind, it should be noted, as you can tell from the images, that we're really looking at layers predominantly as an example, but there's obviously going to be some nuances for each. One of the things that's going to be a little bit more consistent is humane euthanasia. So, as Aaliyah mentioned, everything that we were doing prior is either on a carcass or relative to a live bird. And it's important both to do those examinations when you have the birds, but it's good to have those examinations when the birds are in their natural environment as well, how they interact with other birds, how they interact with the rest of the flock to see if they're being aggressively chased and picked, to see what other behaviors they're exhibiting or not exhibiting as a result of any observed condition. Aaliyah gave a good example of some of those external conditions that we look for, foot pad issues, especially on the broiler side, and a little bit on the cage-free lay. Dehydration, nutrition deficiencies, which, especially in organic flocks with binding limitations, can look like brittle feathers and feather loss. Parasites, as well as other general feather cover. All of that becomes really important to set the stage for not just what's happening in the barn, but what can happen after. And most importantly, it's not a one size fits all solution or a giant red flag as far as a condition. Our job, as we kind of go through the internal evaluation as well, is to just gather those data points. We see some feather issues. We're not screaming nutrition first, but it's a data point that when we collect all the information, be it flock production, barn walkthroughs, necropsy, tells us a story about what's likely happening. And then we can follow it up with other tests, whether it's a diagnostic lab test, feed evaluation, particle size, all these different things that can really flesh out and definitively pinpoint any type of challenge. So going from that bird that we're seeing and is in the environment, alive or recently deceased, to euthanasia. For any bird that's live that we're going to be posting, it is important. We are noting that you really be needing to follow either AVMA guidelines for humane slaughter or whatever is dictated within your individual programs. So if you're under United Egg Producer guidelines, if you're under National Organic Program, they all have different standards and requirements that are going to denote what methods of euthanasia are going to be appropriate in addition to AVMA guidelines. So primarily that's going to be cervical dislocation and or CO2 asphyxiation. So making sure that you have the right equipment to follow the protocols that are outlined and also the appropriate training for anyone who's assisting within that matter. Additionally, we really recommend that people dip those birds in Nolvasan and water solution for a couple different reasons. You can either do a dunk in the bucket or spray them down with a solution. It prevents some potential risk from zoonotic conditions that can arise from feather dust. So it just kind of helps protect everyone who's working in that environment. Additionally, it helps us with how we actually examine those birds. Aaliyah just gave a great outline of when those birds, especially if you have live bird specimens, what to look at. But their appearance can change once all that feather is matted down. It creates a cleaner environment for us to work with. We can get more precise cuts. There's less dust, and it gives us, again, kind of another layer into examining the outside features of that bird before we then go and start cutting in. My preference is to start at the head and kind of work our way down the animal. So we're not going to go into great detail on the external evaluations, but it does follow pretty much the same once over that you did prior when that bird was alive and feathered or when they were initially deceased. So again, kind of looking through the inside of the mouth, I like to cut off the eyelids to get a better view of that whole ocular area, any kind of discharge, discoloration that we see, re-examining the wings, looking for, it's a little bit easier at this point to see bruising or any other type of condition that is hemorrhaging under the skin. Also re-examining the vent, legs, and inside of the mouth. We like to make kind of that first cut once we're in the head area, and then there's also others that are more precise that are going to make full cuts into the head, looking at the brain and other more precise organs. For most field postings, especially at the farmer or producer level for checks, we really kind of want to go more in the mouth, making that cut down the neck. The easiest thing being using the esophagus to guide those scissors. So kind of having the fine point of the scissor into the mouth, making that cut straight down the esophagus, and that leads you right to the crop and down the neck. So once you have that exposed, we're really looking for, again, what's normal. It's not necessarily important that you know all the diseases of poultry. There's whole classes and professions built around that. The most important thing is there something that's worth contacting a further technical resource, whether it's a technical rep that you work with, a veterinarian, even your nutritionist to help facilitate that information and identify any potential challenges. So within the esophagus, what are we looking for? We're looking for pretty much the same thing we see within other mammals and people, is consistent coloration within that tube, even lines for that peristaltic movement down into the crop, absence of any types of mucuses, blood, or discolorations. Now, there are two tubes in the neck, the second being the trachea. And so we like to kind of do the exact same thing, cutting down the trachea or windpipe towards the base of the neck and into the lungs, especially for any type of upper respiratory condition, but also environments such as dust or ammonia. We can see some challenges in this area. And so what are we looking for? We're looking for, as it's an area that transports air from the mouth to the lungs, nothing. We want it to be fairly clean so that air is just passing down into the lungs and air sacs and moving back up. And that's what we see here in this demonstration, is these striations that give the trachea its structure, and we're really making sure that it's clean. What do we not want to see? We never want to see any type of blood. We don't want to see foreign material. We don't want to see mucus. And so again, do any of those things give us a slam dunk diagnosis? No, but if you see them, those are things that are obviously worth taking note.
Awesome. Thanks, Tim. I'm gonna continue on with actually looking into the body cavity and what we're looking for once we're inside that bird. So starting off, you want to make an incision right below the keel bone. So once you have that bird flipped upside down, you can feel that keel bone. You should be able to feel the keel bone pretty prominently. And you want to make a small incision at the bottom of it. And then once you make that small incision, you can start to peel back the skin. You may need to make a couple of extra cuts down the side, but once you have it started, you should pretty easily be able to just peel the skin back from that breast muscle, which is going to expose the breasts. And these should look pretty similar to what you're seeing in the grocery store. When you go to a Walmart or a Hy-Vee, looking at the boneless, skinless chicken breasts from the store, you should be seeing something that looks relatively similar. No lesions or blood spots, no striations or white striping. And this is going to ultimately, once you expose that breast muscle, give you the chance to bend the legs back, and you will feel a pop. And once you are able to dislocate those legs back, you are left with a very clean and pretty well prepared area for you to move on to the next step. And so once you get to the actual body cavity itself, you're going to have to make another cut underneath that keel bone. So we've peeled all the skin back, we've made our, prepared ourselves to actually get into the bird. So now we're going to, again, make that small cut underneath the keel bone. And then once you make that cut, you can pretty easily, again, just pull back the breast muscles and that keel bone to expose the first body cavity that we're going to be in. And you'll be able to see the liver as well as any kind of fat pad if it is present. In here, if you continue to pull back, you can make a couple of cuts down the ribs to help you further expose things like the air sacs, your heart, and your lungs. So once you make the cuts down the ribs, that helps you to further pull it back. And in this picture, you can see we've now exposed the heart, those air sacs. You can see the pink lungs right down in that divot, as well as your liver all pretty in front, staged for you to look at. So again, before you start to cut into these organs and remove them, it's really important to visually examine these things as you go along, because once you start cutting, it's really hard to put back together. So making sure that you're making observations before you kind of start, take your time, because at the end of the day, it's better to go slow and make sure you're getting more information rather than fast and getting less, because again, you might miss something that may not seem like it's important to you, but it might help a veterinarian or a consultant kind of see what's going on. So making sure that you're making those notations before you actually start to cut into these organs or remove them is really important. So starting off with the first organ, it's going to be the heart. And I did want to make a note here that, some of these things, I have a different order that I like to go in than Tim. So we're going to go over a pretty basic order, but again, this could deviate from how you may choose to do it, as long as you're making sure you're preserving the intestinal integrity as you're going through. It doesn't super duper matter what order you go in for the most part. There are some things that you can't get to until you remove something else, but overall, just look and see what's up top, what's up front, what are you seeing, and it should tell you pretty obviously where you should go next. But again, with the heart, it's pretty easy. There might be a couple of membranes, but just making sure, you can simply just grab it and make a cut below that heart, and should be left with a pretty decent looking, about maybe the size of a large grape here. Um, and it should be, again, homogeneous in color. You can cut into the heart if you wanted to look at the ventricles or the chambers of the heart, but it should be a pretty solid color, not too fatty, and free of any kind of bruising or lesions. So moving on to the lungs, you can see whenever you are cutting through the ribs, a lot of the time you can cut off a piece of the lung with that rib, and it'll be a lot easier for you rather than peeling back the ribs from the lung. And what you want to do is to make a cut down into the ribs and kind of across, almost making a square. and you can cut out a piece of that heart. And by the time you're finished, you should be able to see something like a very bright pink, um, firm but spongy, free of any fluid or nodules, any kind of exudate coming out of that lung. It should be a very bright and firm, spongy organ. Moving on to the liver, the gallbladder, and the spleen, you can look and see underneath this liver, there's some membranes and there's some organs. So we want to be really careful when we're removing the liver, because underneath the liver, you're going to have the spleen and the gallbladder. And the gallbladder contains a green liquid that if you accidentally cut into it or rip it, tear it off, it can spill that green liquid everywhere and really make it difficult to kind of see the color of some of those other intestines that you might want to look at. So looking at the liver itself, you want to see a very deep red, um, homogeneous in color, free of any spots, lesions, yellowing, or any type of necrosis. And then similarly, the gallbladder, which you can see in this picture, and also the spleen, um, that gallbladder should be, full of a green liquid. And then that spleen should be a deep purple or red color, about the size of a large marble or maybe a small grape. Any kind of discoloration, enlargement, or any sort of modeling can be indicative of a challenge, especially since this is an organ that has immune function. So important to look at that as well. So now we're going to move on, and we're going to start with the digestive tract. So, starting with the crop, this is going to be the first place that feed goes. It serves mainly as feed storage. And how you get to this is when you are opening up that bird and you're pulling the skin back from the breast, you can just keep pulling it back and it will eventually expose that crop right at the top of that breast muscle on the side. And you can cut into the crop to examine the contents, and you can even remove the contents if you would like and examine that inner membrane. And then, so once you are past the crop, in order to expose and kind of see the rest of that digestive tract and reproductive tract, you'll need to cut through another membrane and a fat in the fat pad if it is present. Um, so looking at the proventriculus, if you have, kind of that, depending on whether or not you're gonna, cut through the breast to actually expose the crop, the proventriculus is pretty easy to spot. You just find the gizzard and kind of pull that out, and it is attached towards the top of the gizzard. Now, this is a pretty easy cut to make. You just find the small proventriculus, cut off from that tube that connects it to the crop, and then you're left with just another cut that you need to make to separate it from the gizzard. This is going to be your bird's true stomach. It's, like I said, located between the crop and the gizzard, and there may be some connective tissue kind of separating it, or some fat that you may want to pull back to expose it a little better. But this is going to be leave you with an organ that's roughly the size of the heart, but it's going to be skinnier and longer. So when you cut lengthwise as well on this organ, you can look at that inner membrane, and it should look pretty similar to this picture in the bottom right. Homogeneous in color and a pretty pale pink. Sometimes you can have some pale yellow, depending on, again, how much fat is present, maybe some dietary, um, you know, assumptions there as well. Moving on to the gizzard, again, we just made the cut to take away the proventriculus from that gizzard. We're now going to make a small cut to separate the gizzard from the start of the small intestine. And this is a very muscular organ. It's responsible for grinding up the feed, and any kind of grit that you're adding to the diet is doing its job here. So once you've got that proventriculus out, it should look like a large muscle. I mean, it's a pretty sizable organ. It's pretty heavy. And it's going to be kind of similar in size to a whole walnut. And similarly to the proventriculus, you can also cut this organ open lengthwise and see what's inside. Um, should look like your whatever you're feeding that bird plus your grit. And if you remove that feed content, you are left with what should be a very deep yellow color, homogeneous in color as well when it is healthy. So moving on to the duodenum and the pancreas, this is going to be the first part of our small intestine, and it is going to kind of encase the pancreas. So in the picture, you can see it's in a loop, and in between that loop is going to be your pancreas. And both of these organs should be free of any type of lesions, bruising, should be a homogeneous kind of pale pink color. And you can separate the pancreas from the duodenal loop relatively easily by just carefully pulling it apart. Um, and then you can kind of examine it separately from there. So looking at the next part of our small intestine now, we're looking at the jejunum and the ileum. Again, still part of the small intestine, but we do like to kind of, differentiate because with certain challenges such as cocci, or worms, there's certain types of challenges that can present themselves in different areas of the small intestine. So what you want to do is basically take from where you separated the duodenal loop and go down to your two cecal pouches. And you want to make an incision down at the bottom, right where those two cecal pouches kind of shoot off of that intestinal tract. And then there is as well a Meckel's diverticulum along this small intestine. This is where the yolk is going to be attached. Whenever that chick is born, it's still absorbing nutrients from that yolk. So that's where the residual yolk will lie, and it will eventually finish absorbing and the yolk will disappear, but you're still left with a very small protrusion from that small intestine that's known as the Meckel's diverticulum, and that is what's going to separate your jejunum from your ileum. So moving on to the ceca, like I mentioned, these are two cecal pouches, and they are going to have some fermentation going on. And you may also notice when you're walking barns, maybe some of the droppings may look darker or pastier than others. That may not be an issue. That may just be your cecal droppings. And in order to separate these, you just make a small cut at the bottom of each, right where the large intestine starts, and you can separate those two and then cut into them and kind of examine the contents of those as well. Moving on to the large intestine, like I mentioned, we just cut off the cecal pouches from there, and now really the only cut you would need to make is right where the large intestine is about to meet the exit of the body. So that cloacal area, that vent area, going inside and cutting at the cloaca will separate that large intestine, and it's a pretty small section of intestinal tract. But again, this is kind of what it looks like laid out from the vent cloaca up to that place where your two cecal pouches split, and that's going to be your large intestine. So with your small and large intestines, as well as the cecal pouches, you can make some additional observations by looking on the inside of these. You want to make sure that you're taking a representative sample of each of these organs. So I like to do a few inches in the middle of each section. So in the middle of the jejunum, in the middle of the duodenal loop, in the middle of the ileum, and so on. And you can cut it open and look at the contents. What do they look like? As that feed goes down in the intestinal tract, it is going to start to look more and more like what you see on the floor of the barn. And then, looking at the intestinal walls, looking at the membranes. Um, is there any kind of hemorrhaging? You can see bruising or maybe some lesions, some nodules, plaques, and things like that. But looking inside this intestinal wall and inside at this membrane can tell you some things that you wouldn't be able to see otherwise, including something like worms. Worms are often going to live inside of these intestinal tracts, and by cutting them open, you can expose that and kind of see those pretty obviously. This method can also be used to take certain samples, but again, work with that diagnostic lab, and they'll typically provide you with instructions for that. And then moving on to the reproductive tract, you can see here we have it's kind of hard to see, it's not the best picture, but we have the follicles and then we have the rest of that ovarian tract where that follicle is going to travel through. And then looking at the follicles themselves, you should see a pretty good mix of small and large follicles. This is kind of showing that progression of each. So each of these little small uh, beady circles or spheres are going to eventually become the yolk of an egg. So you should see as they mature, they do get bigger, and once they reach a certain size, I mean, that's the size of the yolk that you'll see in an egg. So a healthy bird should have a good mix of both developed and non-developed and developing follicles in that intestinal tract. And again, there should be no real signs of any type of internal hemorrhaging. If maybe you'll only see small follicles, it likely means that bird's just not in lay yet, or maybe stunted development, things like that. Lastly, you can see the kidneys by removing these reproductive organs, and they should be pretty homogeneous in color. They're not the biggest, and they are kind of set down into a little divot, so it's a little hard to remove them cleanly, but you can definitely just look at them while they're still in the bird. They should be kind of a pretty dark red, homogeneous in color, like I mentioned, free of any kind of bruising, lesions, or anything like that.
So as Aaliyah mentioned, when we start looking at what these actual organs when we're opening up for, we're not, without speaking too much towards specific diseases, because that could take days. What we're going to kind of briefly go over is what are the broader categories of things that raise red flags when we're looking at these birds, things that make us either get a vet involved or move towards the diagnosis. So when we look at any type of organ or body system, for the most part, we want them to display a uniform, solid color. And really, for a lot of people, your experience, if you don't have a ton of experience opening birds, you can really rely on your experience just as a lived human being as well as a consumer. Because when we start looking at things in the supermarket, those are usually going to be normal. USDA plant inspectors, they're trying to take out anything that considers disease. Your own experience of what inflammation and other diseases look like. Strep throat is an example. Almost everyone's had it at some point. You open your mouth, you look in the back, and there's all these little dots. So these same general concepts are actually going to apply really well to the poultry space. So generally speaking, when Aaliyah talks about opening the gastrointestinal tract, looking at the liver, we want them to be solid, normal colors. What do we not want them to look like? Spots and dots are going to be one of your abnormal things that are usually indicators of some type of either damage, bacteria, or viral growth. So things like spotty liver, as the liver removes toxins and or gets harmed by bacteria, those bacteria kind of form colonies and circles, and they're going to manifest with those little dots on the liver. Coccidiosis in the middle disease is going to cause lesions on the gastrointestinal tract, depending on what species is causing that infection. And we're going to be able to see those visually. It's either going to be like necrosis in the cells, especially for like a necrotic enteritis, or lesions for coccidiosis. But we can see these little circles where those Eimeria penetrated and were replicating. And so similarly on the viral side, for example, fowl pox. It's a little bit more strikingly obvious when we look at the birds, but at the same time, we're seeing these dots, in this case, as kind of those warts on primarily comb and wattles in the face at large. So again, if we're seeing spots and dots, whether it's internal or external, that's something that's definitely noteworthy that we want to kind of bring into that record. Additionally, discoloration of an organ, whether it be internal or external, is also going to be a pretty big red flag. And it's again not just for diseases, it's also production performance, genetics, etc. Because we have conditions such as white striping and woody breast. Woody breast becomes really easy to identify when you just feel the breast, but even white striping is visually differentiated by that discoloration. We can actually see the striping within the meat. And it's something that we look to evaluate, at least from our end, on the nutritional programs, the growth of those birds, how we manage them to kind of reduce that condition. So, not everything is always going to be a disease. We have things like fatty liver, where really we see the litter kind of liver changing color compared to what we would consider that normal to be. And we also have associated conditions from very severe, such as high path avian influenza, where you can see a lot of that discoloration in the comb, wattles, and face, or even dehydration and lighting issues or maturity issues for pullets when we see some of those very light, underdeveloped combs. So it's again, we're not rushing to judgment. We're not rushing to some type of conclusion. What we're trying to do is collect as much data as we can about the flock, and then at the end, utilize that to develop a strategy or next steps. The last key indicator that's going to be most common is going to be some type of inflammatory response. And inflammation is a response to injury, infection, or irritation. And we see it again from our own experiences as people. It manifests the same way in birds. When you have ocular discharge and then inflammation around the eye to the point where the bird can't even open it. We see it with hawk joints. For example, or even things like kinky back, where you have a bacterial penetration, but then inflammation that expands the joint. That's more around that hip joint, but still we're seeing those kind of inflammation, infections, irritations, and we see it in kind of the mucosal lining of the gastrointestinal tract as well. So is it a little bit puffier? Is it a little bit more red? Again, it's really important to understand what normal is. So when we see something that has, a little bit more mucus, a little bit more irritation, you don't necessarily need to know what exactly the causative agent is. We just need you to know that it's not normal. How can I start treating it, or who do I contact to develop an appropriate plan? So at the end of the day, we really need producers and some of those allied representatives to understand the importance of necropsies and the importance beyond just a veterinary diagnostic space, something we can use to monitor flock health and track some of those mortalities, especially in a lay flock or even in broiler. We're going to have periodic mortality throughout the duration of that flock. But understanding the dynamics of that mortality, understanding if there's a potential causative agent, can really help us get ahead of any type of challenge or rectify that challenge before we significantly lose performance. Resources are available if you need help for identifying challenging, collecting samples. Any of your state veterinary diagnostic labs or local veterinarians that you have a vet client-patient relationship with are going to be imperative to helping you determine what samples need to be collected, as well as understanding what to do as a next step to really diagnose any type of illness. And practice makes perfect, but perfect is not the end goal. It's important to be consistent in monitoring what your flock mortality looks like, what previous flocks have been, documenting and establishing your own procedures. Because even in severe cases where veterinary staff might not be close by, just being able to open up a bird, snap a couple pictures, send it to them, even if they're still coming out, just that 6 hour head start can sometimes get the wheels moving on some of those longer term things, understanding, okay, it's something we're going to need to take specific samples for, and being able to go out and gather those resources while the technician's coming in. It's about if it's something like high path, understanding that we have to quickly change how we interact with that barn so that we're not spreading disease and adhering to all the state and federal guidelines. So all those things really become important for getting that early detection, which is going to be key. So the last thing that we'll leave you with is just more information from our end as well. We have a blog post that highlights some of the slides that we've gone over today in a little bit more detail, especially related to some challenges, as well as a video of Aaliyah and that process online for your review. So it's something you can just kind of use as a tool, especially if you're new to that process. And if you have any questions, feel free to reach out to either of us individually as well. We see a couple questions come through the chat. Otherwise, if you also have any questions, please feel free to post them there, and we'll take the remaining couple minutes to go through some of those and answer any additionals. Thank you. So the first question that we have is, what organs tell you the most during a necropsy? Which is a good question, but kind of a loaded question. Whenever we look, generally speaking, gastrointestinal tract is going to likely tell us the most, but it's going to depend on every single operation and type. And what I really want to discourage people from doing is jumping to a specific organ. Even on the technical staff, we kind of have our ideas walking into a barn based on flock histories, based on style, location, etc. What we're being told about a flock if we're posting a bunch of birds that have a known challenge, we kind of have an idea of what we're going to find. Maybe we're expecting it to be spotty liver. Maybe we're expecting in a cage-free flock or organic, we're going to find some worms. But it's really important to not put those notions in the forefront because that's how you start skipping steps and jumping to find what you're looking for. And maybe spotty liver is there. We can jump in there and say spotty liver, but that doesn't mean it's the only thing that's going on. So there's always a little bit more nuance. And so we recommend everyone to kind of stick to that protocol plan and consistency. Take all data points available to you, both in terms of the bird, production, and environment, and put them together at the end instead of just focusing on lesions in the gastrointestinal tract or spotty liver or liver discoloration or anything else.
I have one here. What kind of pictures would be best to send to a veterinarian if I have a challenge? I mean, for that, I would say it just depends on kind of what you're concerned with, but also more is better. I mean, if you're unsure about something, snap a quick picture of it, and send it along. And then also, I think Tim mentioned it earlier, but sending production records is also huge, because a lot of the times we can see some of these symptoms and you can take pictures and send it along. But one thing about poultry is that quite a few health challenges look very similar to each other. So partnering some of these images that you're capturing with production data can really help that vet or the diagnostic lab or kind of a consultant nutritionist. It can kind of help them put together the pieces a little better and differentiate some of those challenges from each other that may look very similar to the naked eye.
But one that was just asked, which is a great question for clarification, but I didn't mention earlier, is will this be available? So yes, everyone who attends or signs up to attend will have an email with the link. So this presentation will be available through that link to review as well. One of the other questions was, and I think it piggybacks really well off of what Aaliyah just answered, is kind of that next step. So, all right, you're taking pictures of certain organs. How should samples be stored or shipped to the lab? So if they come back and say that it's something needed in order to get further diagnostic or is worth additional testing on. It's going to be dependent on the lab. One, I recommend calling ahead to the lab just because scheduling is just as important as sample collection and storage and understanding what they want. Kind of like we mentioned about representative sampling, getting a sick bird and some healthy birds. A lot of diagnostic labs like that too because they're not in your barn. They don't have your production records. There's a lot of forms they like you to fill out, but it's different than having eyes on the actual animals. So in what we've worked a lot with, which has been like Iowa State Diagnostic Lab, Minnesota, South Dakota State within our northern region, um, a lot of times calling ahead and asking how they want those samples is really important because sometimes for them, for scheduling, it's actually easier to take live birds if possible. And again, that goes kind of that biosecurity piece as well, making sure that it's a smart decision to send those birds. If it's high path, then they're going to say no and want tracheal swabs or some other diagnostic testing. But they're going to tell you and usually have those instructions pretty well clearly laid out online and or over the phone. They're always happier to walk you through those shipping instead of them getting a box of hot organs that have been in the mail for 3 days. So that becomes really important. The short answer to the question is typically in a sterile vial or Whirlpack bag and on ice. And then kind of expressed, either driven same day if possible or overnighted on plenty of ice is the short answer. But the long answer is they'll be more than happy to go over the specific sample collection protocol for you. And that should be about all for today. I want to thank everybody for their time and attendance today. If you have any questions or comments, please feel free to reach out. Hopefully, this was beneficial. And we encourage you all to, again, use this to look further into your flocks and better understand what you can do to maximize performance on your birds. Thanks.